PRP, or platelet-rich plasma therapy, is perhaps the most interesting and recent innovation in hair loss treatment. We've seen this technology and monitored it over the course of years in other fields of medicine, including orthopedics and cardiology, where it helps facilitate new healing, cartilage rebuilding, etc. Practitioners in the realm of hair transplant surgery have also begun to embrace it. And we at Pacific Hair Institute have become believers that this therapy, which utilizes the patient's own blood, and in fact, the serum can be helpful in combating hair loss. The technique is simple, one that we will be demonstrating later. An employee simply collects a small fractional of blood via venipuncture into one of these special designed tubes. Then centrifuging the blood, concentrating the platelet elements that contain an array of growth factors, which are then re-injected into the scalp in areas of hair loss, and over the course of months to years, provide support to the hair in that area. Having collected this sample of blood, it is now being transferred into this tube. It will then be placed into the centrifuge, which will perform the task of isolating the platelet elements, which we will demonstrate shortly. The last preparation step in the PRP involves the removal or separation of extraction of the now isolated PRP component of the plasma serum, which is withdrawn with a syringe from the centrifuge tube. Now, we are going to begin the process of injecting the PRP into the scalp. So having been isolated, this is a simple matter of injecting small fractions of the PRP into the entire treatment area of the scalp.
Okay, so Debbie here had a hair transplant about, a year ago or so, to the front of her head. We also brought her hairline forward. We also filled in some scars from some surgery she had over on the sides and so forth. So anyway, 6 weeks ago we gave her first PRP treatment in this front area. And today we're about to do the second one. So tell us what you've observed as far as your hair growth in the front.
Yeah, well, where they put the PRP in, it's been growing faster. I mean, I had my haircut 2 weeks ago, and I already need my bangs trimmed again.
So the PRP we put in this frontal part here by the
Correct.
hairline, right?
Yes.
And so what you're saying is that these bang hairs are growing faster than the hairs on the rest of your head?
Correct.
Yeah, I think it looks that way.
Yeah,
It
'cause
looks that
it's-
way. So 6 weeks ago, here's a mirror. So 6 weeks ago, these bangs were what? Where were they cut at? Up here somewhere?
No, I actually had a haircut 2 weeks ago.
2 weeks ago.
2 weeks ago. And she cut it so that it was up,
Above your eyebrow?
yeah, just a little above my eyebrow.
Okay, so that being the case, then it looks like these hairs have grown about 1 inch in 2 weeks.
They're going crazy.
That's pretty impressive.
Yeah.
Yeah. So do you want, now that we've completed the mission, do you want to say anything else? To the camera,
It
that
really
is?
was not all that painful. I mean, it hurt, but it's not unbearable.
And you could have elected to have anesthesia, but
Sure.
you said you didn't want it. So.
Correct.
Yeah.